Tomorrow. Welcome, everyone. Thank you so much for joining us for our Your Fertility Guide webinar with Dr. Rahi Victory. Thank you so much, Rahi, to be with us tonight. I don't know if I need to introduce you because you're very well known, but I'm still going to say a few words. You're an OBGYN, you're specialized in fertility, you are double board certified in the US and in Canada. And we asked you to do this webinar, and you very kindly agreed to do it because we like your approach. It's really centered on patients. You really believe that personalized care and tailoring treatments to individual needs is key in the fertility journey. And when we thought about having a webinar about male fertility, myth, truth and the path moving forward, we couldn't think of a better speaker to do that. You also host on a weekly basis a very successful show called Fertility Fact or Fiction. If for the one who are joining this webinar, if you haven't watched this show, I truly encourage you to do it because Dr. Victory answers a question during an hour. It's from 8 to 9, I think,
Yeah, it's usually from 8
on
to 9, although
Tuesday.
we always run over, but we answer questions live from all over the world. So it's been really fun.
Yeah. Yeah, and helpful. On top of being fun, I think it's very
I hope
helpful for
so.
patients. So thank you so much, Rahi, for being with us, and you can start. The
Thank
floor
you
is
so
yours.
much for that very wonderful introduction. I think I'm only famous in my own head and nowhere else, so we're still working on it. Well, thank you for this amazing opportunity. Thank you to the amazing Fertility Friends Foundation, who has done so much good for the fertility community in Canada, and really has changed the field for us because no one was doing this before. So a huge round of applause for Isabel, who has brought this mission and this passion to life. And year after year, it just seems to get bigger and better. And so, congratulations to you for
Thank you.
everything that you do. This is a really wonderful, noble endeavor, and I'm proud to be part of it. So, yeah, terrific work. Isabel already kind of told you guys about me. I'm a big believer in transparency, in truth, and in having a better system for fertility in general. So, to that end, we spend a lot of time on social media trying to teach people, and I can go over that at the end. If any of you have any questions, don't hesitate, throw up your hand. I can't see it while I'm sharing my screen, but Isabel will just shout out and let me know and I'll pause. And I really appreciate this being interactive. So I will skip that. Okay, so overview. We're going to talk about an intro to male infertility. We'll talk about the male infertility workup, which is important because more and more there are additional tests coming out which can help us in certain instances which before we had no answers for. We're going to go over some of the myths, which are really important. And then we're going to talk about lifestyle, the environment, and male fertility. And then we're going to talk about treatments. And there's even some newer ones that are kind of coming around the corner that I didn't integrate into the talk, but I will speak about as we go. It's not on the slides per se. Okay, so intro to male fertility. So what is male fertility? Essentially, it's your ability to conceive, right? I mean, not rocket science, everybody knows that. But it also has a lot to do with your general well-being and your health. Amazingly, as I delved into knowledge about male fertility, I found things out that they never taught us and that I never knew about. So, your frequency of ejaculation determines how long you live. It determines your risk of heart disease, cancer, erectile function or dysfunction, various types of cancer too, actually, colon cancer, prostate cancer. So, male fertility is more than just male fertility. The overall health and wellness of your sperm and yourself kind of mirror each other. And so if you're generally an unhealthy person, you're very likely to have unhealthy sperm. Whereas if you're a healthier person, you're much more likely to have good quality sperm. So depending on which kind of, research article you want to look at, essentially somewhere between a third to 40% of infertility is caused by male factor. Another third to 40% is caused by female factors, and then about, one third to 20% of them are caused by both. So you'll have both a male factor and a female factor. That has been true more recently. In the past, it tended to be more female factor, and over time, we're starting to see male factor rise. This is not an insignificant problem. Currently, essentially about two-thirds of all cases involve the male at some level. And the big reason for this is that sperm quality is plummeting. And if you're not terrified about this, you should be. So I'm going to give you some stats that should put everybody to pause for a moment, okay? Number one, we know that sperm quality has declined rapidly. From the last kind of 50 years or so, we have seen a huge decrease in sperm performance, 51 to 62% decrease in sperm count and concentration, just from 73 to 2018, and it doubled after 2000. If you need better proof of this, the World Health Organization qualifications or standardization of sperm reports is estimated that 50% of men will be infertile by 2050. And that is not a long way away. I mean, we're talking 25 years from now, half of the world's population will be infertile. That is a staggering number. So we're not talking about half of the reason for infertility. We're saying half of all men will be infertile. And that is a huge number. I created a video last night with our social media guy looking at, where is this coming from? And one of the things is something called a neonicotinoid, which is a nicotine derivative, but they spray it on crops in order to avoid insects. It's a pesticide for all intents and purposes. So they studied babies and adults in the US, and 50% of all males over the age of 3 have significant levels of this pesticide, which goes into the fruits and vegetables that they grow and that they spray this on, so that even when you wash it with soap and water, and if you're one of the members of my family, they're a little OCD, so they're scrubbing away at it, you're not doing anything. It's actually in the meat of the fruit and the vegetable. So this stuff is getting embedded in what we eat, and then you're ingesting it, and they are massive endocrine disruptors and mitochondrial disruptors. So there are some very tangible reasons for why sperm is going south, and it is going south. That's just one reason. Heat, smoking, drinking, drug use. There are a number of factors that are going into this obesity, all of which are going to significantly negatively impact sperm quality. And it is going to be very, very significant over time. If you need kind of more proof of this, right now, the estimate is that by 2050, 50% of the world's countries will fall below their population replacement rate, meaning the population will begin to shrink. By 2100, that estimate is that it'll be 97% of the world's countries, and the 3% that are still meeting their population replacement rate will be in Africa. So all sort of developed countries throughout the world are going to be struggling with their population. And I asked ChatGPT what would happen, and I won't play it for you now, but it wasn't pretty. It's a very terrifying future. If we don't do something about our fertility, we are headed towards sort of a global problem. So it's really important that we focus on the men, because we're actually becoming a bigger problem than the women are. And that doesn't mean we shouldn't focus on the women. Female fertility is critical, but the guys are becoming more and more the burden, whereas before that wasn't the case. Of course, improving male fertility is critical to improving cycle success. I've seen countless cases where the sperm was poor quality and people were led into IVF cycles and told, don't worry about it, IVF will solve this. Yeah, that's simply not the case. If you do the best ICSI in the world, but the sperm is still terrible sperm, you're still going to get a bad result. So improving the sperm is critical to improving your success, whether you're trying naturally or you're trying IVF or even a frozen embryo transfer, because your sperm impacts the quality of the embryo. So the fact that it's fresh or frozen still impacts the embryo that is developed in it, and it has a very negative impact in some instances. What is it specifically? It's the ability to produce mature sperm and deliver healthy sperm. Male infertility occurs when any step in the process of creating the sperm is disrupted or altered or dysfunctional. There are a number of key parameters. So we look at the count of the sperm when we're doing a semen analysis, and this is your kind of primitive basic semen analysis. We look at the motility, which is the percentage of the sperm that move. We also look at the progression, which is the percentage of the sperm that are swimming in a straight line and going quickly. We look at the morphology, which is the shape of the sperm. The sperm have three parts. They have a head, a neck, and a tail. And any of those parts or all of those parts can be abnormal. And if they're abnormal, the theory is that those don't really work. They just are kind of duds. Those are incapable of actually generating a pregnancy or fertilizing the egg. And more, we're looking into other things, including one kind of progressively more mainstream test, which is called DNA fragmentation. So if you all remember DNA, it looks like a ladder that's being like twisted. And if you look at those side rungs of the ladder, they can have fractures in them. And that's where the DNA starts to get weak. And that's what DNA fragmentation actually is. It's fractures in that side rung of the ladder. So when it comes to sperm, if you have too many of those fractures, you are impacting virtually every step of the fertility process. So less fertilization, less blastocyst development, possibly higher chances of genetic abnormalities, and for sure a much higher risk of miscarriage. So we're looking more and more at integrating that DNA fragmentation test into the sperm testing. Now, most of the time, if the sperm is very strong, you don't really expect to see that there is a high sperm DNA fragmentation. It occurs once in a while, but typically not the case. But when the sperm is weak, or if the male has risk factors for DNA fragmentation, you will actually see a significant negative impact on this. It takes about 75 to 90 days for sperm to develop. And so when you're looking at sperm, if you have an ejaculate sample today and it doesn't look good, it actually reflects what started happening basically 2.5, 3 months ago. So keep that in mind. If you had a really bad cold and a raging fever, for example, COVID, during the COVID pandemic, sperm quality plummeted because COVID annihilated your sperm just by virtue of high fevers, infections, overactive immunity. And so it had a very negative impact. That has been true for ages. We've known that for a very long time. It didn't need COVID to tell us that. We knew that ahead of time. And so if you have a party and you're off in Vegas with your friends and smash drunk and trying to relive your younger days, you are definitely going to have a negative impact on your sperm. If you are a smoker or a nicotine user, negative. If you are a marijuana user, hugely negative. So even things like your diet, your habits, these can all have a very negative impact on the outcome. So it is really important to understand the process of what we look at when we're looking at sperm and what we're actually analyzing in terms of your sperm performance, because we're not looking at a snapshot in that time. We're actually looking at what has happened to your sperm over a period of time of roughly about 3 months. Okay, well, what do we do for the workup? So shown in the picture here is a microscope, which is great. And then that little chamber that you see, that silver one, is what we used to use. And now we have some more sophisticated slides that we use. That chamber is world famous because it was patented by an Israeli company, and it's called the Mackler chamber. And it just makes it very easy to count the sperm. We still have one, but I have no idea where it is because they don't use it anymore. But the Mackler chamber allows you to put a little tiny droplet of the sperm on the slide and then slip it under the microscope, and you can count the number and how fast they're moving and are they going in a straight line and what kind of morphology you have as well. Okay, So a semen analysis is the main test used to evaluate male fertility. There's no question. You walk in the door, we need to do some blood work on you. We need to check you for infectious diseases. At VRC, we check metabolics, your cholesterol, your sugar, your blood type, things like that. And then we will do a basic semen analysis as well as your hormones. So this is really looking at the quality and the quantity of sperm. As I mentioned, we're looking for how many sperm there are, how many of them are moving, how fast are they moving, and how many of them have a normal or abnormal shape. There's some other things. We look at viscosity to see how thick it is, what percentage of the sperm are alive. For a long time, we were also doing an overnight survival test, which allowed us to see what percent of the sperm survived overnight. If it's less than 56%, even with insemination, your chances of success were less than 3%. So we were very careful about doing that. And then my lab came to me, actually not my lab, my finance department came to me and told me how much it was costing us. And we unfortunately had to stop that because I was losing about $100 per test. But we now still offer it. We just charge $100 to make up for the loss. The results really guide your steps as to what you're going to do. You got to remember that this is just a snapshot in time. You're really just capturing what happened on that day, and that day is reflecting what happened starting really 3 months ago. So we don't use one sperm sample to make determinations. At least we don't. I'm sure some places do, but we make sure that if you have a bad sample, we repeat it to have another look and see what it looks like. And we also sort of collate it or cross-reference it with your other factors. What are your lifestyle factors? Have you had previous sperm samples done before? What did they look like? What's your general health like? And then, of course, what are your hormones like? If you have very little sperm and a very high hormone profile with high FSH, high LH, low testosterone, you know that you have testicular failure. That's not a good outcome. And so we have to act on that quickly. That's not something where you bring the patient back over and over again to retest. So the results guide our steps. None of this is a judgment on the patient, but it allows us to have some information to take the next steps and move forward. Again, if you guys have any questions, don't hesitate. So aside from the basic semen analysis, what other tests can we do? Well, first, it's when should we order other tests? So if your semen analysis is abnormal, certainly you can repeat it or order additional tests. If you see very significantly different results from one test to another, you can do that too. However, I do want to point out there is an enormous difference in semen assessments between different labs. And I don't just mean IVF clinics, I mean all different labs. So if you go to your garden variety Life Labs or Dynacare or whatever, they really are not good at doing semen analysis. And even some fertility centers are using criteria that were from World Health Organization standards established 20 years ago. So when I get them and I look at them, I'm reading it and I'm going, where are they getting this from? This doesn't even make sense. So, every center is a little bit different, and it's important that you validate which reference they're using. So for example, if you're told that like 40% of your sperm are normal, you automatically know that place does not know what they're doing because that is a decades old scoring system for sperm. Nobody has 40% of their sperm normal anymore under the new sort of model called strict criteria. If you have very low counts or you are azoospermic, which means there are no sperm seen, you definitely need additional testing. If you suspect that there's problems with transporting the sperm from the testicle to the epididymis or from the epididymis out, that might need additional testing. Concerns for hormone imbalances, you feel weak, you feel tired all the time, you're losing muscle mass, you're suspecting your testosterone levels are low, you might be losing facial hair and so on, body hair. Any history of something significant? You had a torted testicle, you had undescended testicles, you were exposed to chemo, radiation, chemicals, that kind of thing. Or in a situation where it's not actually readily evident, but your partner actually is having a problem. Recurrent pregnancy loss being number one. And infertility itself is kind of potentially a test marker for male infertility because 2/3 of the time you're involved. So, as a male. So, if you and your partner are infertile, there's a damn good chance it's you. And like I said earlier, that chance is increasing over time. So, what additional tests can we offer? Well, as I mentioned, sperm DNA fragmentation is kind of the number one test. It's not particularly cheap. It's actually costly for us to do, and it takes a lot of time. But when done well, this can really provide a lot of information. Men who have over 15% sperm DNA fragmentation are considered to have high DNA frag. Once you're over 25%, the risk that your partner will have a miscarriage is increased as high as 12-fold. So the actual number is 1,183% increase in risk. It is massive. So this is not something to just sideline or not consider. It is very important. Are there ways to improve it? There are lots of ways to improve it. And so knowing that can actually help you in that process. And we'll get back to how to improve sperm in a little bit. A scrotal ultrasound is where we ultrasound the scrotum. And essentially, you're looking for structural problems. So the most common one would be excessive veins, which are like varicose veins around the testicle. Those veins cause the testes to overheat. And as a result, you create more reactive oxygen species. Reactive oxygen species are the devil for the sperm. And so that's really very harmful and something that we need to take care of and fix. Hormone testing as well, very important. So FSH, LH, testosterone, estrogen. Sometimes we look at some other hormones too, but those are the main ones. We'll check your thyroid often also. And for the guys that have no sperm, we'll look at Y microsome deletions. We'll look at your cystic fibrosis status, which is the CFTR gene. We will look at your karyotype as well. There are some newer tests as well. There's a company called Flow Labs, which has developed a marker that they can measure from your blood, which will tell you if you have any chance of finding sperm when you are azoospermic, which is quite interesting because they can do it from the seminal fluid and look for this protein ratio. And when it's over a certain threshold, they know that that translates into a reasonable chance of actually finding sperm. You can now also look at the genetics of the sperm and see if you have a higher than normal percentage of genetically abnormal sperm. And then we have some really sophisticated tests we do here at VRC. So we can look at the oxidative reductive stress in the seminal fluid, which essentially tells you, are you taking enough vitamins or are you even taking too many vitamins, which can actually be harmful. We look at something called hyaluronic acid binding, which tells us what percentage of the sperm are mature. If they're not mature, they won't usually fertilize or give you very poor fertilization with the ICSI. And then we also look at that overnight survival test that I mentioned earlier. Again, don't hesitate to ask me if you have any questions, guys. I want this to be super interactive. Okay, what sort of myths? I don't think any of those people in that last picture had anything to do with fertility, but anyways. So myth number one, fertility is a women's issue. It is not a woman's issue at all. As I mentioned earlier, 1/3 of infertility, at least, probably more, is male factor. And another third is related to a combination. So in all cases, at a minimum, and it's probably higher actually, at least 2/3 of all cases of infertility have some component of male factor in there. So this is not a woman's issue anymore. We get a lot of guys that come in and, the bravado is there and they kind of come in feeling like they're not the problem because they knocked up their previous girlfriend with no issues and they don't want to quit smoking a pack a day. And then when you show them their sperm analysis, it's like a massive wake-up call because all of a sudden they realize, oh, they are the problem. And indeed, in many circumstances, they are. So it's very important that the guys understand that this is not a female problem anymore. The guys are a big part of the issue. And over time, this will become progressively more and more significant. Male, male fertility does not decline with age. Yeah, that's not true either. So you can still conceive even when you're a very old man, but your chances go down. Your DNA fragmentation goes through the roof, and the quality of the sperm is drastically decreased. More importantly, the offspring outcome is compromised. The older a male gets, the higher the chances of things like autism. So it's not like you're not passing that along through your genetics. You are passing that along through your genetics, and you do that through the sperm. So there is no question that the factors that contribute to sperm health decline over age. Some of those are increasing environmental exposures as you age. Some of those are declining testosterone levels as you age. And some of it is just continuous, bad habits, whether you were smoking or drinking or using drugs or not working out or even not ejaculating as often. 50% of men over the age of 40 have erectile dysfunction. It's a huge number. It's the reason Viagra is a multi-gajillion dollar empire, right? So the reason for that is there are so many men with erectile dysfunction. When you have erectile dysfunction, you're definitely not going to be ejaculating as often. And the moment you stop ejaculating as often, your sperm quality plummets. So all of these things are reflective of age. It's a confounding variable in there, and you got to know that that's really critical. Frequent ejaculation leads to male infertility. You're running out of sperm, or my favorite expression is shooting blanks. So actually, that's not true. Men produce an enormous number of sperm. It's 1,500 sperm per second. So you're not going to run out. And in fact, the more frequently you ejaculate, the better the quality of the sperm up to a maximum of once a day. When you start going past once a day, two things happen that are really important. One, you are actually not able, from a testicular standpoint, to keep up with that pace for very long. And two, it is highly likely that your partner will try to kill you if you are trying to go at it multiple times per day over and over and over again. And if she doesn't, then hallelujah, or he doesn't, hallelujah. But that's not the norm, certainly. So please be cautious and don't impose upon your partner. But you definitely will see an improvement with more frequent ejaculation rather than infrequent ejaculation. And so some people, I see it all the time in clinic. They're like, well, we save up, right? Like we only try around ovulation and the rest of the month we're not really trying. And I'm like, oh God, here we go. So you need to tell those people they need to have sex every day or every other day the entire month. Because if you're waiting a week or 2 weeks or 3 weeks and not ejaculating, and then all of a sudden you start, all the sperm you ejaculate the first 2 or 3 times is basically dead or mangled. And so by the time you get to the good sperm, most people have already missed the window of opportunity. And so they're already past the ovulation. And then anything you do after ovulation, 0% chance. Is completely useless from the standpoint of getting you pregnant. Great for sperm quality, but terrible for getting you pregnant. So it's really important that you are ejaculating all the time. During the, if you're in a heterosexual relationship during a woman's period, obviously most people are not having intercourse, but you can still ejaculate, find other ways. And the rest of the time, it's every day or every other day. The other thing that's important is that the ejaculate actually primes the endometrium to accept an embryo. So for the ladies that are going to tell their partners to just go do it on their own because they're sick of them, it doesn't work that well. You need to have the interaction to help improve your chances of implantation. Male infertility is always permanent. No, that is absolutely not the case. In many cases, we can actually reverse male infertility. And some of the new stuff that they're working on looks very promising for even the men that have azoospermia, which we never were able to fix in the past. So there are some really amazing things that are coming up. There's lifestyle modifications you can make. There are supplements that you can take. There are medications coming around the corner. There are surgical treatments that we have available if you have a varicocele, all of which can drastically alter the quality of the sperm, and in many cases, actually help you get pregnant on your own without needing to, seek or require the assistance of fertility treatments. I remember once upon a time I had a gentleman who had frequent nocturnal emissions. And when I say frequent, sometimes as frequently as 19 times per night, just while he was sleeping. And so by the time he was ready to fool around, there was literally no sperm left because he had been ejaculating all night long. And so he had a real problem with that. We put him on some vitamins. We got him some medication that slowed things down, and they got pregnant on their own. And He had so few sperm, they thought they needed IVF, but it actually worked by itself. So there are some ways to make this work naturally. I always tell people not everything is IVF, so not everything is IVF. Okay, lifestyle, environment, and male fertility. Uh, okay, so weight and metabolic health are hugely important. For my male friends who are struggling with a bit of a paunch and they've got some extra, chunkiness about them, it has a massively negative impact on your sperm quality. Enough that your sperm DNA fragmentation is affected, your sperm count is affected, your motility is affected, and your morphology is very affected. Excess weight will increase your levels of estrogen, which directly counteract your testosterone levels and drive them down. And that is not healthy for a male to have. So you very much need to be aware that if you are carrying a lot of extra body weight, you will very likely have compromised sperm. And even if your sperm numbers are okay, I virtually guarantee you'll have damage to your sperm DNA fragmentation. Alcohol, so I always freely admit my bias here. I personally have never had a drop of alcohol in my life, nor will I. But alcohol is designed to annihilate your sperm and your testicles. It literally shrinks your testicles. It reduces your sperm performance in every regard. It's an 83% increase in the number of abnormal sperm. It can have permanent impact that can transmit to the baby. So, for example, babies that are created when the dad is drinking even 3 or 4 drinks a week have a 50% increase in their risk of having a cardiac defect. So this stuff is very significant. And the way I always try and convince people, and hopefully this will resonate with some of you, is that during the pandemic, all of us were frequently using hand sanitizer to keep the virus and bacteria and wherever else was out there off of us. And you did that in order to kill everything it came into contact with. Well, hand sanitizer is vastly and predominantly alcohol. If it's killing everything it comes into contact with on your skin, what do you think it does when you actually put it inside your body intentionally in a way higher concentration than what's in the hand sanitizer? It destroys you from the inside out. It's a cellular toxin, it's a class 1 carcinogen. They know for a fact that 7 different types of cancer are directly attributable to alcohol intake. So alcohol should be eliminated entirely. Nobody should be drinking it. If you're trying to conceive, just get rid of it completely. Equally harmful, smoking and vaping. It's a train wreck disaster. So the reason smokers have a cough is because lining the cells of your lungs are these tiny little hairs on the cells called cilia that wave. And what they do is they wave in a uniform pattern all together, and it's directional, designed to move mucus up out of the lungs so that you cough it out and you get rid of it. The reason smokers cough so much is smoking directly stops the cilia from moving. They halt. And so the mucus plugs into the lung and you've got to force it out by constantly coughing. Well, the tail on a sperm is literally the exact same protein as this hair on the cells of the lungs. So when you smoke, you actually stop the sperm from moving, just like you stop the the cilia on the cells in the lungs. So smoking is an annihilation of your sperm. Every single aspect of sperm performance goes down and your DNA fragmentation massively increases. So please stop smoking. It's so bad for you. And the same is true of marijuana, by the way. You are not saved by switching to weed. It is equally bad and horrific on the sperm and actually has other transmissible things that you can pass on to your fetus, which affect the fetus's neurological development. So marijuana is not a safe drug. The same guy that legalized marijuana resigned as prime minister, in case you've forgotten. So it was never a smart thing. And I'm not political, but I'm just saying that one move was really health-wise stupid. Exercise, huge improvement. The more you exercise, the more your weight's going to be controlled, your metabolism will be controlled, your cholesterol will go down, and your testosterone will go up. So, and you'll have better sugar control. All of these are critical for your sperm performance. So it's really important that you make sure that you are adapting to the right amount of exercise. Sleep is also important. I'm very lucky that I had my children early in life because Lord knows once you're into residency and later on into practice, I don't sleep very much, about 5 hours or 4 hours a night usually. And so I had my kids early on in life, but if you're trying to create children now, try and get good sleep because your circadian rhythm is directly responsible for your hormonal management. And if your hormones are off, you're not going to be able to produce sperm. So that's really important. People always ask us about stress as well. Stress has a negative impact, has an impact on your hormones, raises your cortisol levels, that has metabolic effects. And because of that, you may be suffering from sexual dysfunction, decrease in your sex drive. You can have problems with the actual sperm generation and production. So, stress is something important. As a society, we do a very poor job of raising kids to deal with stress. And so now we have an entire generation of people that really are not adept at being able to handle or manage their stress. And so that's really important for people to understand. They need to find pathways or mechanisms that they can incorporate to reduce their stress because it is important for your sperm health. Environmental factors. So heat is really bad for your sperm. Um, Heat comes in all sorts of forms. People that put a cell phone in their pocket, it's a disaster. They've actually proven that it decreases your sperm performance. Hot tubs, saunas, jacuzzis, terrible. Your car seat heater, proven to be detrimental to your sperm quality. So any source of heat or electromagnetic radiation is bad. Laptops probably have the worst name in history because they should never be put on your lap because they are beaming your testicle with EMF and you're getting hot, both of which are really bad. Truck drivers, competition bicyclists, cyclists, all those things, anything that's putting pressure or heat up against the testicle, proven to have a detrimental impact. Any kind of occupational or work-related exposure to radiation or electronics does the same thing. As I said, the cell phone in the pocket is a disaster. Um, I know this sounds ridiculous, and it probably is, but my wife recently bought me a mail purse, which I never thought I'd ever use in my life, but I just took it to Brussels with me for the first time ever. And I have no idea why all men don't carry a purse because it is just an absolute wonderful thing to have. So put your cell phone somewhere else, but don't stick it in your pocket right next to your testicles. It's a bad habit. Chemical exposures, as I mentioned earlier, these neonicotinoids, pesticides, plastics, solvents. I have a clinic in Sarnia. Our clinic in Sarnia is in an environment where there's a lot of petroleum processing, and all the guys there have bad sperm because of the fact that many of them work in these industrial, chemical laden environments, and it's really bad for the sperm. Um, Chemotherapy, certain prescription medications can do it. And then, of course, all the recreational drugs are bad for your sperm quality. Um, the one exception here is caffeine, which is not a recreational drug, but is an exposure. Up to 2 or 3 cups of coffee per day is actually beneficial. But beyond that, it starts to clamp down the blood vessels, and that's actually harmful. So if you're a heavy caffeine drinker, maybe moderate it a little bit. Air pollution definitely is linked to lower sperm counts and motility, but it's really hard to tease out the details because you can't exactly intentionally expose people to bad air and then tell them you want to analyze their sperm. So we do believe that there are significant impacts, but it's hard to do that kind of research. Okay, what sort of supplements help? Well, any kind of basic vitamin assortment that is going to reduce your reactive oxygen species is going to help. The main reason sperm undergo damage is from reactive oxygen species. So I don't know how much you guys remember from basic chemistry or biology, but an oxygen molecule that is missing an extra electron becomes a free radical, which then runs around trying to find a free radical to make itself balanced again by ripping that electron from another atom. And in doing so, it causes all kinds of havoc and damage. And so essentially, you need to quell those free radicals. That's literally what vitamins are for. They are to suppress free radicals. That's how they work. So coenzyme Q10, the fish oils, zinc, selenium, L-arginine, L-carnitine. There's a whole host of them. Folic acid. All of these are very important vitamins for men's sperm production and performance. Diet patterns, eat healthy, guys. Don't be eating crap all day long. If it's coming from Tim Hortons, it's probably not healthy. So avoid stuff like that. Fast food, terrible. Greasy, oily, sugary, sweet. None of that stuff is good. You want a diet that's rich in fruits and vegetables and whole grains and fish. That's what's going to be good for you. That's what's healthy. If you're downing red meat and having steak and burgers every day, it's not healthy for you. It's a 40% increase in risk of colon cancer for that matter. Healthy fats, so the omega-3 rich foods. There are foods with this. Sorry, I should say there are vegetables with this, and of course, fish is very rich in omega-3. Lean protein. So if you are going to have some red meat, don't do it often and have it in a lean format. And then try and minimize the amount of processed foods that you're eating. All the sugars, anything that comes in a wrapper, fast foods, high fats, that kind of thing. Okay, what kind of treatments do we have and what's the path forward? Well, if you're obese and you have underlying health factors, fix the obesity. These days with GLP-1s, it's easy. Go see your doctor, tell them you need to lose weight. They'll throw you on Wegovy. Yes, it's expensive. It's well worth it. I can say that from experience because I was getting chubby and I went on it and I lost 25 pounds in 2 months. And so you should get on something to reduce your weight. It's going to improve your health. You'll reduce your snoring. Your sexual function will improve. Your erectile function will improve. Your hormones will improve. It's very good for you. If you have diabetes, metabolic syndrome, you got to take care of that. If you have high blood pressure, you got to take care of that because that may not directly impact your sperm performance, but it does impact your erectile function. And if you can't perform, you're not going to be ejaculating, and that's going to affect your sperm performance. Sleep apnea, when you stop breathing as you're sleeping, that's a disaster for your sperm production because you're depriving your body of the oxygen it needs. And so that's hugely important. Any kind of sperm toxic medications, typically this is in a select group of people where they are on something that can have a negative impact. So that would be people like that are getting organ transplants and they're on cyclophosphamide or azathioprine, that kind of thing. Those are typically fairly negative for sperm. But even people that are on antidepressants, there is new data coming out saying that antidepressants are very bad for sperm quality. So if you don't need to be on an antidepressant, don't be on it. Half an hour in a gym exercising with like HIIT training is better at removing depression than any antidepressant is. We have trained people to take pills instead of training people to stay healthy. So, stop paying money to the drug company and go join the gym, pay the gym instead. It's way better for your health. Mental health as well. Again, get rid of the stress, improve your sex life and your intimacy. Better overall health means better sperm quality, and that means better outcomes. So remember that equation because it's very simple and it's very elegant and it's very true. If you need medical treatment, it depends on what's wrong. So I'm going to break this down very simply into a couple of categories. Assuming you have sperm, then the next thing you want to know is your sperm poor quality because your hormones are off? So if your hormones are low, things like Clomid, HCG injections will help you. If you're obese, you're producing too much estrogen, so aromatase inhibitors will help you because it blocks the conversion of testosterone to estrogen and estrogen to testosterone. So it improves that. Antioxidants and supplements will help you as well in certain circumstances. If your hormones are high, meaning your FSH is elevated, you need to be evaluated immediately because that means your testicles are probably failing, in which case we need to make sure that we are addressing that as quickly as possible. If you have no sperm, then you need to know, do you have no sperm because there's a failure of production or a failure of delivery? So some people aren't producing sperm, which is very difficult to correct. And some people are just not able to get the sperm out, which can be bypassed by extracting the sperm. How do you extract sperm? We use this when the guys have very poor quality sperm or they've done IVF and had very poor quality outcomes. So you can take a sample of the testicle with a needle and try and suck out the fluid. That's a TESA. Tessie is where you actually remove a chunk of the testicle. There's microtessie where we actually kind of open the testicle and then look for individual little areas where the testicle produces the sperm and pull those out and check them under the microscope. And then sometimes you can just stick a needle into the epididymis, which is that worm-like looking thing around the testicle, and pull sperm out of there. So all of these are possible mechanisms by which to do it. All of these are designed to help the guys who are not delivering the sperm out. And in some cases, in the guys who have very, very weak sperm, you'll still find some in the testicle. So these are surgical things that we can do to improve things. The other thing that's coming around the corner is uh, just back in the medical treatment here. We now know that vitamin A is very important. And someone did a study, and I have no idea how they figured this out, but we're now duplicating it, where they gave guys the acne medication, isotretinoin, which is a vitamin A derivative. And 80% of the men that had no sperm, they were azoospermic, but not blocked, they started producing sperm after 6 months. There's also some basic science stuff going on where they're realizing that certain components that are present in the sperm or seminal fluid might have a very significant impact on sperm performance. Aldolase being one, it's a specific enzyme, and they're noting that that specific enzyme may be the control factor for the production of sperm. So you might start seeing drugs and treatments coming out targeting specific factors. When you still have a sperm problem, despite all the things we've done to improve it for you, or you've done to improve it for you, you can try IUI, which is where we take the sperm, wash it, concentrate it, feed it kind of what I like to call Red Bull for sperm. So they're all really excited to swim. And then you inject that right into the uterus so the sperm don't have to work as much. You do need to have sperm and you need to have open fallopian tubes in the female, but it is an option for you. ICSI is the other one. So IVF can be done, just conventional IVF, where you pour the sperm into the dish with the egg in it and you pray overnight that they fertilize. Most of us are using ICSI, where we individually select the best sperm and inject it into each egg, expecting a fertilization to occur. And in a good lab, you can get very high levels of fertilization, which is great. So that's what we do pretty much universally for our cases because we want to keep our success very high. And so we do that all the time. This can even be done for sperm that is immotile, meaning they don't move. We've had guys do this with sperm that don't have tails. We've had guys do this when there were motility problems, morphology problems. You can look for hours and find the one or two good sperm and then use them. For DNA fragmentation, ICSI does not necessarily help because we can't distinguish which sperm is fragmented or not. You just have the overall number, but there are devices coming out which can reduce the amount of DNA fragmentation. And here's the easiest thing anyone will ever tell you to do. Ejaculate twice, 3 hours apart. The second sample has 80% less DNA fragmentation in it. So that's an easy way to do it.
I have a question for you, Rahi.
Yeah.
Is ICSI what is done before an embryo transfer, or is it different?
No, ICSI is when you've just had the eggs retrieved, and then the people in the lab go through the sperm sample under this insanely expensive microscope, and they individually pick one sperm at a time, and they take that sperm and they inject it into the egg to force the fertilization so that you get an embryo.
Okay. Thank you.
Sure. Does that answer the question?
I think so.
Okay.
She will
Let me know.
post, she will, yeah, she will.
Let me know if you need to have more stuff answered. So how couples can move forward together. So male fertility is common. It's becoming increasingly worrisomely common, and it's treatable. In most cases, we can reverse this. Both partners need to be part of the solution, and you're looking at a medical evaluation as soon as you possibly can. Healthy communication between you, your partner, and your physician. And definitely finding a good physician that knows what they're doing. Um, I was just with some clients of ours in Brussels when I was there, and they had originally selected to work with a different clinic. And they said that the reason they chose to work with us after they had already chosen this other clinic was because on the spot he showed me, and I remember it really clearly, his semen analysis. And he said, "What do you think?" And I pointed out a whole bunch of problems, and I said, "This is not good. You need to fix this." And the other clinic had told him he was perfectly fine because they just wanted his money. And so you need to make sure you're working with a clinic that is reputable, not just in terms of their reputation, but like one-on-one, listen to what the doctor has to say. If they're dismissive or say, "Oh, don't worry about that," you got to worry about everything in the fertility world. So it's important to make sure you're getting good advice from caring people. Shared decision making with your partner and to some extent with your doctor, but I always give you the education you need to make the decision yourself. And I think most good fertility specialists do. And then emotional support and counseling. I actually had a guy faint in my room when I gave him his semen analysis results. A lot of people don't understand the toll it takes on men when they find out they are the source of the problem. You're raised to be strong and tough and hardcore all the time, and then all of a sudden the rug is pulled out from underneath you because you find out you're the source of why your wife is unhappy or your partner is unhappy, and that's a lot to bear for a lot of men. So that's an important part of this as well. You are not alone. There's lots of us here to help you. There's naturopaths, there's traditional Chinese medicine specialists, there's your family doc, although they generally don't know enough, urologists, infertility specialists, OBGYNs. Like there's loads of people there that can help you with this. And that is everything. I probably spoke way too long.
No, you haven't. Thank you so much. It was very, very informative. Actually, I learned a lot.
Oh, good.
Um, I have questions for you, actually, because it's the first time that I'm hearing that recurring miscarriages can be connected to male fertility. How frequent is that? And is it a new discovery or is it something that happened like you knew for a long time?
I'm trying to get my mouse to actually let me stop sharing. Can you stop sharing for us? Because we don't need to share anymore, and I can see you. My mouse has disappeared for some bizarre
Ah,
reason.
let me see if I can. Uh, hmm.
Ah, I think I got it.
Ah, good because I don't think I can.
No, that's not working. For some reason my mouse is toast. In any event, I'll hopefully get it to reconnect at some point. So, sorry, ask the question again then. I got distracted by all this.
The connection, let me see. Yeah, I
There
managed
we
to
go.
get
Yeah.
the connection between recurring miscarriages and male fertility.
Yes. Yeah. So sorry about that. So there's a very intimate connection between recurrent miscarriages and male fertility. So if you have high DNA fragmentation, your risk of having a miscarriage is much, much, much higher.
Mm.
If you have a very high abnormal morphology, your risk of miscarriage is higher. So all of these things affect the sperm quality, and that sperm quality then affects the embryo quality. So it is really important to improve your sperm quality, or else you are at a higher risk.
But just a follow-up question, is it something new, the connection between recurring miscarriages and male fertility, or is it something that has been known for a long time?
Um, no, I think we've known that for quite some time now. I don't believe that it's new. I think the DNA fragmentation story has been around for a number of years, probably 10 to 15 years now, but it became more popular over the last sort of 7 or 8 years.
Mm.
And so the more we learn about it, the more we're understanding how important it is.
I'm asking because I had recurring miscarriages. So my son now is 14 years old. And when I had that, we were referred to a fertility clinic who ran tons of tests on me and told me and my husband that he didn't need to be checked because recurring miscarriages is always the woman. So that's why I'm asking because I'm like, Wow.
Yeah, you need to go back to that clinic and start yelling at somebody. I mean,
Yeah.
14 years ago, they probably didn't know enough. I will
Mm.
admit that. I don't think I ever would have told anybody that it's only the fault of the woman, because that's a really easy way to get a very angry patient. But yeah, you
Or a
need,
desperate one. Mm.
yeah, for sure. So
Gutting.
you need to definitely have a good perspective anytime there's recurrent miscarriage or recurrent implantation failure on what tests are necessary. But anyone that ignores men as part of the fertility journey just isn't practicing good infertility.
Mm. I have a quick question for you from Monica. Over and above standard sperm tests, volume, motility, etc., and the fragmentation test, what is the cost of doing all the extra stuff?
So we have a bundle. I don't know about what other people charge. We have a bundle where we do the DNA frag, the oxidative reductive potential, the hyaluronic acid binding, and overnight survival test for $750. So that's for everything combined. A DNA frag alone is about 300, 350 at most clinics. So it's not that much more to get all these extra tests. And they are really time consuming. These are not money makers for us by any means. We just do them to get answers for people. The genetic testing of the sperm, the one that tells you how many karyotype abnormalities there are in the sperm or what percentage of the sperm are genetically abnormal, we don't do that here. That test is run by a couple of different companies. Flow Labs does it. I believe iGenomics does it as well. Um, that test, I think, is around $750 as well. The problem with that test is, unless you're going to use the information to not use your own sperm, it's useless. So let's say you find out that you have a very high proportion of genetically abnormal sperm. Okay, what are you going to do with that information? If you turned around and said, well, I still want my own child, I can't know which sperm is normal or abnormal just from its appearance. So it doesn't help me and you wasted $750. If you would look at it and say, whoa, I got a really high level of abnormal sperm. Maybe we shouldn't use my sperm. I'm open to a donor. Sure, then it's a great plan. But shy of that, it doesn't make any sense.
Thank you very much. It's over 9 p.m., so I think we will let you go. But well, we if you have other questions, I'm saying that for the people who are going to watch also this webinar afterwards, they can send us questions and maybe we can forward them to you, or they can connect to your show on Tuesdays at 8 p.m. and ask the questions live, and you will answer them live. Thank you so much, Rahi. Thank you
My
very much for
pleasure.
this amazing webinar. Again, we will send an email to all the people who registered so they can watch it, and we will also promote it on our social media platform so they will be able to watch it later. Where could we find a link to Dr. Victory's show? Good
Sure.
question.
So we're on Instagram, YouTube, Facebook, X, and TikTok on Tuesday
Wow.
from 8 till 9, simultaneously on all of them. So you can watch us on any of them. Um, Most people, I think, tend to watch either on TikTok or on Instagram. About 5,000 people view the show per week, so it's pretty popular. I cannot get to everybody's questions, but I do tend to answer questions people ask me on Instagram. So if you need to DM me or I didn't get a chance to answer your questions here, ask away and I usually will respond to you. So it's just rahivictory.md on Instagram, and I'm happy to answer your questions.
And you can also send us the questions and we will forward them to Rahi, to Dr.
Yeah.
Victory.
And if anyone has any questions, send them to Isabel and I'll be happy to fire off an email to you.
Thank you. Thank you very much. Next, so you were the last webinar speaker of the year.
Oh,
So
great.
thank you so much. You're closing our Your Fertility Guide series for the year. We'll start again in early 2026, and we already have our seven first webinars of the year planned until July. The program will be out very soon, so stay tuned. And thank you so much again, Rahi, for this amazing webinar and for your
My
time.
pleasure. Thank you. Have a
Thank you.
wonderful evening, everybody. Nice chatting with you all. Take care.
Thank you. Bye bye.
Okay, bye-bye.